I'm Jessica Buzlog, and today I'm going to demonstrate NG tube insertion. We start by verifying our physician's order and the indication. We're going to gather all of our supplies. I have all mine here. I have my gloves, an 18 French NG tube, 60 ml syringe. I have a pen light. I have a basin with warm water, tape, lubricating jelly, specimen cup, a pH strip. I have a safety pin or clip. I have a towel here for the patient. And I have a cup and straw. And I have stethoscope around my neck. Also, I've verified that the suction is in working order behind the bed here, kind of back in this area. Okay, so I'm going to knock and I'm going to enter the patient's room. I'm going to close the door behind me for privacy. Going to perform hand hygiene. Hi, sir. My name is Jessica. I'm going to be your nurse today. I need to verify your name and date of birth. Okay, Mr. Smith, I'm just going to verify those two things, your name and date of birth, with the information on your wristband. I'm going to explain the procedure. Mr. Smith, today your doctor has ordered an NG tube. That is a tube that's going to come from your nose down to your stomach, and you're going to have light suction remove those stomach contents, and that is so that your stomach and bowels can get a rest and recovery. Okay? I'm going to put on my gloves, and I've raised the bed to a good working height, and I have had Mr. Smith elevated up to a high Fowler's position. Yeah, he's at a good working height. Okay, I'm going to then put my NG tube, open it up here and put it in my warm water in this basin. That's gonna warm it up and make it more pliable to insert. I've got your towel across your chest here, and I'm gonna have you look way up, Mr. Smith. I'm gonna inspect the nares. I'm gonna look inside these nostrils and check for there's no deformity, there's no obstruction, the membranes are intact, there's no abrasions or redness, so that looks good. I'm gonna ask you to cover up one nostril and take a deep breath. And I'm gonna have you, thank you, I'm gonna have you do that on the other side. Cover up the other side and take a deep breath. Okay, it looks like the best nostril for you, the most clearest spot is gonna be your left side, and we're gonna go ahead and do that side today. I'm gonna take this out of the water, it's all warmed up, and we're going to measure now from the tip of the nose to the earlobe, and then from here to the earlobe to the xiphoid process. I'm gonna mark the spot here with a piece of tape. Oh. Okay, Mr. Smith, I'm gonna have you, go right here, there we go. I'm gonna have you look way up. I'm gonna put this into some lubricating jelly, okay? I'm gonna have you look way back and hyperextend your neck. I'm going to insert this into your nostril, just into the nasopharynx, just towards the top of the nostril there. There we go. There we go. All right, once you feel that hit the oropharynx, I'm gonna have you put your chin to your chest I'm gonna have you take a sip of water. When you swallow, I'm going to advance another 2 to 4 inches. All right, great. So if I was having any trouble, that hit the oropharynx there and moved back. If I was having any trouble, I would remove this and re-lubricate and try the other nostril, but we're okay here. I'm gonna have you take another sip of water. And when you swallow, I'm going to advance another 2 to 4 inches. If there's a lot of gagging, I'm gonna let him rest and take a couple of deep breaths, take some more water if needed. He's doing really good. Every time he swallows, I'm gonna do 2 to 4 inches. All right. Now, this last bit is the hardest. There, okay. We've gotten close to our mark there, and I'm going to go ahead and aspirate the gastric contents, 5 to 10 mLs. And I'm going to put that into my specimen cup. I'm going to do a pH, whoops, my light fell, a pH test. I want to see that between 1 to 5. And if I see that, that's a pretty good confirmation that it's in the stomach. I'm going to, once I get that confirmation that it is stomach contents, I'm going to secure, wish I would have done this ahead of time here. Where's my tape end? Here it is. I'm going to secure the bridge of the nose, the tube to the bridge of the nose there. Okay. We're also going to get confirmation from an x-ray. I'm going to attach this tube. Once I get that confirmation from the x-ray, I'm going to attach this tube to the suction. And I'm going to clip this to his gown. Whoops. All right, there we go. And I'm going to make sure that that suction is unclamped and patent. And I'm going to then, once we're done with all of this and we're all set, we're going to discard all of our supplies. And I'm going to remove my gloves. I'm going to do hand hygiene. And I'm going to document the procedure as well as all of the care that I did, as well as any assessments, as well as the patient response to the assessments.